Hi, everyone. Dr. Magaziner here in Cherry Hill, New Jersey at my office. And, we're all in the midst of the COVID crisis, the coronavirus that's caused by the COVID-19 virus. And I've come up with my 5-point plan that I want to present to you. I've been using this in many of my patients now, and we seem to be having very, very good results. So I'm just going to talk to you about my experience in doing this. I'm not telling you that there's scientific evidence for every single thing I'm saying or there's double-blind placebo-controlled trials. However, I will tell you that I've seen very good results so far with our patients as they're staying well and they're staying healthy. And we're keeping them out of the hospital, which is which is so crucial right now. It's keeping them out of the hospital so they don't have to go onto a ventilator, get intubated, they run into kidney problems and such. So the first part that I'm going to discuss today is going to be food and nutrition. But overall, my 5-point plan will include food and nutrition. The next day, I'm going to present to you my lifestyle changes, the suggestions I have for lifestyle modifications. My third day is going to discuss the supplements that I am recommending. The fourth part of my program is going to discuss some of the IV nutrients and IV therapies that we're using in our practice. And the fifth and final for this series will be regenerative therapies. So I hope you'll tune in each day, and I think that we'll all learn a lot from this. The first part today, I want to talk to you about what I call my superfoods. And actually, before I get to superfoods, I just want to preface by saying, do your best to eat wholesome foods. Stay away as best you can from sweets and sugars because they suppress the immune system. The more sugar in your diet, the more processed foods, they're devoid of nutrients, they're devoid of antioxidants, devoid of fiber, they're devoid of all the things that help us keep our immune system strong. So if we move on to the next direction we want to do is eat lots and lots of vegetables. And over 50% of your intake each day should be healthy vegetables. So I've come up with my 5 superfoods. There are many more than these 5, but these are 5 that I've been using and most of my patients recommending. So first of all, and not necessarily any great order, but try to eat some broccoli and broccoli sprouts. Broccoli sprouts a lot of us don't use enough of, but you can sprinkle them on your food or onto your salad. They look like alfalfa sprouts. You can buy them in the supermarkets. They're very high in what's called sulforaphane, so is broccoli, and they help protect our immune system greatly, not only from viruses, but also from various cancers that we could be prone to. The next food you should think about is eating dark greens. So all kinds of dark green leafy vegetables are good. In particular, think about incorporating kale and spinach into your diet. Also, Brussels sprouts. A lot of people don't like them, but if you flavor and season them in different ways, they can be pretty tasty, and they're super healthy for you. The fourth are mushrooms. Mushrooms have a lot of what's called beta-glucans in there, which actually help to boost the T cells, the natural killer cells, and various arms of the immune system. And fifth, but not really final, but final for today, will be our sweet potatoes. So anything that has a lot of pigment, a lot of color in them is generally very, very healthy. So these are the 5 that I've selected today, but you should be eating many more vegetables than just those 5. Also, various vegetables are part of the allium family, and these include things like garlic and onions and leeks and shallots. So get used to incorporating these. They have a very good antimicrobial effect. They can help against various viruses, bacteria, funguses as well. So we want to keep our immune system strong with these allium-based foods. The next section are fruit. So we want to eat lots of fruit, but it depends if you have diabetes or if you have other health problems. You may have to be cautious with some of these, although I would tell you that berries are some of the best ones to eat. Why? Because they don't raise the blood sugar very much at all. They have a very low glycemic index. They also are packed with phytonutrients, antioxidants, and so some of the berries to think about would be blueberries, strawberries, raspberries, and even cranberries. You can get them this time of year. Very, very healthy. Kiwi, avocado are good for us too. They're loaded with healthy fats that are so important for our cell membranes, important for the brain, important for the liver and detoxification. So try to eat avocados quite frequently. The next 2, watermelon is good for detoxification, has a good diuretic effect, and also grapes because they are high in resveratrol and pretty high in fiber as well. Once again, these aren't the only 5 fruits, but incorporate some of these. You can incorporate many other fruit into your program as well. What about nuts and seeds? Well, 2 of my favorites are almonds and walnuts. They're very protective for the immune response. They're good against heart disease, against cancer, good for colon elimination. They're terrific. Try to get the raw almonds if you can. If you can't get them, obviously roasted are second best. Also, try to incorporate more seeds into your dietary intake. So some of the better ones could include hemp, chia, and flax seeds. You can get the ground flax seeds. You can also use pumpkin seeds, sunflower seeds, sesame seeds as well. So incorporate more seeds, sprinkle them into your program, into your diet. Some people put them in a smoothie. I happen to like the chopped almond slivers. I just sprinkle that into a lot of my foods each day. Beans and legumes, very, very healthy for us. We don't seem to eat enough in our diet in America, but anyhow, you should. So lentils are a tremendous superfood, a great source of protein, great source of fiber, and you need the protein, the fiber to protect us against infections. Chickpeas, split peas, you can make split pea soup if you want over the weekend. Navy beans, aduki beans, any kind of beans are very, very healthy, and they're a great source of protein and fiber, and also all these foods have some essential fatty acids in them as well. These do, as well as those seeds I just mentioned a moment ago, which are so important for us. Spices and herbs, we need to incorporate some of these. Some of the countries that use more spices and herbs are much less prone to infections and also less cancers, heart disease. So try to use more turmeric in your dietary intake. Ginger's a great one. Ginger's wonderful against infections, and also some oregano. There are obviously more spices and herbs to use. I'm not a great cook, so I don't use a lot of these myself personally, but these are good for you. Most of us are stuck at home right now, and that's probably a good thing. I don't want you going out and running around too much. But what can you do as far as lifestyle to keep yourself healthy right now? So first off, it's exercise. And I know since this crisis has begun, I've been walking around the block almost every day, 1 or 2 times, taking my dog for a walk or just walking with my family. And it's getting us outside, assuming we're not in groups, and I'm not, much more often, and I think it's very important. In addition, I've been doing much more regular exercise in my own home. I have a small gym at the house. I use the elliptical trainer. I've been using the treadmill, and also doing some isometrics, some weights, some push-ups, sit-ups, and various other things as well. So I want you to make sure you're doing something every day, at least 5 to 6 days a week. First of all, stretching every morning when you get up is a good thing to do. 3 to 5 minutes of stretching in the morning. And if you want to do another 3 to 5 minutes later in the day, especially late in the afternoon, is a good policy or a good habit to get into because it keeps us limber and it prevents us from being fatigued and tired. Also, doing at least 30 minutes of some form of activity or exercise 5 to 6 days a week is also advisable. The next thing I want you to make sure you're doing is get involved in some type of relaxation or meditation. Now, some people get scared. They hear that word meditation. So if you're not sure what to do, just a very simple thing you can do on your own. I'll show you what to do right now. And that is simply take a deep breath in through your nose for about 4 seconds. Hold it if you can for at least 4 seconds. And breathe out for about 8 seconds if you can. Now, it may take some practice doing this. You should do this in a dark, sort of dimly lit room. Doesn't have to be pitch black. Room that's quiet, without people, with nobody around if possible. So let's do a couple breaths. So we just simply, it's good to either stare at something on the wall or stare at the floor or just close your eyes if you have to. So you take a breath in through the nose, 4 seconds, hold for 4 seconds. If you can hold for 7, it's even better, but I struggle with that myself. And then blow out for about 8 seconds through the mouth. So once again, I won't speak this time. It's going to be in for 4 through the nose, hold for 4 to 7 if you can, and blow out for 8 through the mouth. So simply. And then repeat it. And while you're doing this, totally relax your body. Sit in a comfortable chair or lay on the floor and tell yourself to relax all the muscles throughout your body. Start with the head, go down to your toes. Muscles of the jaw, the mouth, the tongue should all be completely relaxed. There should be no tension on any of the shoulder joints, any shoulder muscles, the hips, the feet, the ankles, the knees, or anywhere else in the body. If you feel your muscles tightening up, just say to yourself, let it go again. Relax it. And they should all be completely limp. So once again, do your deep breathing along with the muscle relaxation every day if you can. Start doing 5 minutes in the morning and 5 minutes before bedtime. You get used to doing that, I think it'll be a very good thing for you. It helps reduce the stress on the body And we know now that the immune system does respond to relaxation techniques. It's also very important to do some positive thinking. Everyone's feeling down in the dumps a little bit, but it's very important that you think about positivity and love and laughter, and everything doesn't have to, get away from the fear and the pessimism that so many people are feeling right now. So our thought process is very important, and it does shape how we act and how we feel throughout the day. So positive thinking is very good. Important for us, if you're infected with the COVID virus, picture or do some imagery where you picture like Pac-Man and your white cells gobbling up these viruses and destroying them. The next thing, number 4 here, is optimal sleep. It's very important during times of stress, during times of infection prevention, that we try to get extra sleep, extra rest. So try to get at least 7.5, if you can, 8 hours at night to get appropriate sleep, and it should be good quality sleep as well. Make sure you turn off the computer at least an hour before bedtime, because that adds too much activity to our brains. And also try to turn off your cell phones in advance as well, at least an hour, and try to turn off the Wi-Fi in your house if you can. That's a whole other area, but I think the less Wi-Fi exposure we have, the better it is. And then we want to make sure you limit your alcohol intake. These times people, sometimes lean towards alcohol a little bit too much, but it can be a suppressant or a depressant for the immune system. So you don't want to drink too much alcohol. Of course, we want you not to smoke. We don't want you to be exposed to people who are smoking cigarettes either. So that goes kind of without saying. So these are my 5-point plan to help you with lifestyle modifications. Next time we speak, I'm going to talk to you about some of the supplements that I think can be very helpful for you to keep your immune system strong as well. So today we're going to talk about some of the supplements that I've been taking. Now, I probably have boosted up my supplement intake over the last 3 to 4 weeks now, because I'm trying to protect myself so I can still help my patients out. And we're seeing a lot of cancer patients in general still in this office. I have been treating a lot of cancer patients. And it's very interesting to me that I've observed that very few of my cancer patients are struggling at all with any kind of infectious symptoms. I recognize that many people can be asymptomatic, but we aren't seeing patients who are walking in with colds and headaches and fevers or anything like that in those who are coming into the office and taking their supplements on a regular basis, which has been remarkable. So let me mention a few things that I've been taking right now. You all have heard of vitamin C, of course, and it's sort of the mainstay of a lot of infectious disease. Viruses, bacteria, funguses may all be benefited with the use of vitamin C, and I have one called Excellent C, as opposed to, I guess, a non-Excellent C. But anyhow, this is one that I've been taking now, and it's in a capsule form. And I also like capsules better than tablets most of the time because the absorption tends to be better. They open up in the GI tract, in the stomach, they get dispersed, the powders get dispersed, and they get well absorbed. The next one I've been using a lot of, for many years now actually, is vitamin D. So we know that vitamin D not only is good for bones, but it also has a very strong effect against infectious agents, viruses, bacteria, funguses as well. And so it turns out that 2 out of 3 Americans are probably low or deficient in vitamin D. I've been measuring levels now for years, and we know that vitamin D levels are generally low in the overall population. And I like to optimize vitamin D, even though we know that the normal levels, so-called by the labs, are anywhere from 30 to 100. And if you're 32 or 36 or 37, your doctor might tell you you're fine. But if we're in a time like this, a time of crisis, when we're trying to prevent infection, I highly recommend that blood level of vitamin D goes above 50, and preferably between 60 and 80 is the target that I'm looking for in my practice. And frequently it might take 5,000 units a day. In some people it actually takes 10,000 units a day to get to where we have to be. I've seen many people coming in so far whose levels are only literally 10, 12, 14, and 16, 22. That's absolutely too low. Vitamin D helps regulate a lot of the immune pathways, so it's very, very important. The next one I've been using a lot of is zinc. Zinc comes in various forms. This one happens to be a liquid form, but zinc helps to slow down viral replication. It also has a beneficial effect on taste, smell, eyesight, wound healing, many, many other things as well. But it's a trace mineral, and usually we recommend anywhere from 15 to 30 milligrams per day. By the way, if I give you some dosages, I will tell you everyone's different, and I'm not trying to say everyone needs to be or should be on the same amount. But I'll just tell you what I've been using for a lot of my patients. The next one I'm using a lot of is curcumin. Now, curcumin is a wonderful herbal agent. It's a nutraceutical. And this particular one's called Curcuplex 95. It's combined also, there's some black pepper in here, which helps the absorption of curcumin. It's one of the most well-studied herbs out there. It's an Indian herb. It's found in the spice called turmeric. But anyhow, so it has the ability to slow down some of the inflammatory pathways. It has a very anti-inflammatory effect on the body. So I do like that one quite a bit. And the next one, if we move over to the right-hand side of the list here, is what's called bioactive silver hydrosol. These are silver nanoparticles. The particular one I'm using is called Argentin 23. In the health food stores, you may find it as something called Sovereign Silver. Now, this particular hydrosol is very different from what's called colloidal silver, and I feel that this is much more effective than a colloid. A colloid has a lot of impurities in there. They're a very large molecule. These are completely pure, and this is what's called 23 nanoparticles that's in the Argentin 23. Or 23 parts per million, I should say. So anyhow, we use that. It's a liquid. Now, I will say that a lot of these agents that I'm talking about here today are becoming more and more difficult to find in the health food stores or wherever you go shopping because the public is looking for these things now. Berberine, I like a lot. Berberine is also known as golden seal. And this particular one that we're using is called Berberine Balance. And it also has some lipoic acid in here, as well as grapeseed extract. And grapeseed extract has a good effect on our blood vessel health and nourishment. But berberine itself is one thing that can help modulate a lot of the inflammatory pathways. So we like that quite a bit. The last couple things on my list here is NAC, which is called N-acetylcysteine. That is something that helps to keep the lungs in good condition. And we often will combine that with glutathione, I abbreviate it as GSH. But the glutathione that we're using here is called a liposomal glutathione because glutathione is a very difficult agent or substance to absorb. And by the way, glutathione is what's called a tripeptide. It's 3 amino acids linked together that we actually make in our liver. But when we're under what's called oxidative stress or we're under assault from the environment or from infections, our body uses up this glutathione very rapidly, and we may not have enough then to protect us. So we are using this orally, and by the way, I use it intravenously in a lot of patients as well, which I'll be talking about some of the intravenous therapies next time. But anyhow, so we're using this liposomal glutathione because the liposomal form gets absorbed much better than a tablet or capsule form of glutathione. So this one has a watermelon flavor. We had some in the office, but we're sold out now that have orange flavor. And so because glutathione doesn't taste the best, it is a sulfur-containing amino acid, has cysteine, glutamine, and glutamic acid in there. And cysteine tends not to taste too good. So they flavor it with watermelon or orange, and it's palatable that way. And the last one I've been using a lot of on myself is called, for myself and my patients, is called EGCG, which is derived from green tea extract. And by the way, drinking green tea is also a wonderful thing to do. But this is a concentrated form of EGCG, which is a type of catechin. And this also is very important for immune modulation. So we're using that as well. And then the other one, which is not on the list, I just noticed, that I'm using myself, is called Pure Defense with NAC. And it's kind of like a multivitamin type of thing. And it contains vitamin C, vitamin D, zinc, some of the things I just mentioned. And it also has some berberine in it. And it has some Saccharomyces, which is a probiotic type of thing in there. And it also has quercetin. Quercetin is a flavonoid that actually helps the utilization and absorption of vitamin C. So I just wanted to, show you some of the things because people are asking me lately, hey, Dr. Magazine, what are you taking these days? These are some of the things that I'm taking. So if you're interested, we have most of these available at the moment, but we're selling out quickly. We are selling these in our office. If you want to contact us, here's some of the information. We're offering curbside delivery if you need that. And we're also offering free delivery during the month of April, so we don't have to have contact with, you guys can keep with your social isolation, which I think is so important, social distancing. So we are available for you. We have most of these in stock right now. And just get in touch with us, and we can pop these in the mail to you. You can get them in a couple days. one of the things that we've been doing is offering two major forms of intravenous therapies. And I want to tell you that worldwide, these treatments are being used to help protect patients, and not only protect, some are using to treat actual coronavirus patients. Now, I'm not treating coronavirus patients in my practice. I'm sending them, if they have symptoms, to the hospital. But we are here to prevent the coronavirus from affecting our patients. And in fact, we are trying to keep our patients out of the hospital, because hospital settings today are not the greatest place to be. And we want to protect our patients from needing to get intubated and put on a ventilator, because results sometimes aren't so favorable once that occurs. And there's a lot of mortality and morbidity occurring, as we all know. So one of the things that's been used in some of the other countries quite a bit is called medical grade oxygen ozone therapy. This is something very, very unique, whereby a certain amount of blood, typically it's blood, is removed from the patient's arm, and then it is given the oxygen into the IV bag, and then it's reinfused into the patient's arm. Sometimes we even give that, not only that, but we actually add what's called ultraviolet light to the treatment plan as well, because it helps kill some of the different viruses and bacteria. But the oxygen ozone therapy has been very effective. To a point, in fact, in Thailand, they've talked about how effective it's been in a lot of their patients to keep them out of the hospital. The other therapy that we're using quite a bit of is called intravenous vitamin C. And you probably have heard a little bit about that. I posted on some of my social media pages, my Facebook page, and some of the others. There's a lot of studies coming out on this now as to its beneficial effect in just keeping people healthier longer. And if they are in a hospital, they're finding now that they're able to get out of the hospital quicker. They may not be on the ventilator quite as long. Their symptoms are not becoming as severe. And, way back, 1970, 1975, in that range there, Dr. Linus Pauling, who's the only two-time Nobel Prize winner in the entire existence of the world, showed evidence that intravenous vitamin C could help against virtually all or most viruses. And more is coming out now that it may help protect us against the SARS coronavirus. So we've been using this in our practice now, since the occurrence of this virus, but I've been using it for the last 33 plus years. And very, very effective. It's very, very safe when it's done under proper conditions. Now, we are using higher than the FDA doses, or the typical doses. You think of by mouth, maybe 100 milligrams a day, according to the USDA guidelines and such, or RDA guidelines. But when it's given intravenously, it works quite differently, and it's actually what's called a pro-oxidant. It's not an antioxidant when it's given intravenously in high doses. And as such, it has the ability to actually oxidize and to potentially destroy some of these foreign invaders that we're trying to protect us against. So we're using doses here in the practice of anywhere from 15 to even up to, ready for this, 50 grams a day for our patients. So that's anywhere from 15,000 to 50,000 milligrams per day. Certainly much higher than what even some of the hospitals in this country are using, because some of the countries here now, some of the hospitals here in New York are using about 1.5 grams 3 times a day. So they're getting about 4.5 to 5 grams a day for some of the patients. But in other countries, they're using much higher doses, and we're certainly doing it in our practice to protect people against various infectious agents. So these are two of the modalities that we're combining. And actually, when we give the medical grade ozone an oxygen therapy first, it actually has what's called a synergistic effect, and it actually potentiates, which means it increases the effect of the vitamin C. There's studies being also done now in Italy. There's a whole society of medical oxygen therapy that's shown now that it's protecting some of the patients over there. So I'm very excited about it. So these are two of the things that we're offering here in the practice. If you're interested in finding out more, simply call the office, send us an email, give us a phone call. We are still here. We're seeing patients. We're also doing phone appointments. But we're seeing patients, and we're making sure that our patients are socially distanced. We're keeping them separated as best we can when they're in the IV suite. We are asking them to wear masks, of course, wash hands, and all the things that we all should be doing right now. Make sure you're staying home as best as possible. If you run out to the doctor's office for treatment, that's fine if you are taking the proper precautions. And incidentally, I've been amazed how so many of my cancer patients who I'm currently treating for cancer, and we're supporting their immune systems, they're not getting sick, which I'm amazed, because these are patients who are immunocompromised, and when they are on the program that I just mentioned here, as well as the ones I previously mentioned with with the supplement plans that we're using, some of these supplements, as well as some of the IV treatments, we're finding out that these patients are keeping and staying out of the hospital. They are not getting respiratory symptoms. They're not having the shortness of breath, the fevers, the coughs, and I've been very impressed. It's just an observation by me. I'm not telling you I have double-blind, placebo-controlled trials to prove this, but hey, if we can keep people out of the hospital, it's going to reduce the morbidity and mortality greatly. Today, we're going to discuss some of the regenerative therapies that I think are also so important that we need to know more about, because these are things too that can help repair our tissues, especially the lungs, if someone is suffering from ARDS, which is the acute respiratory distress syndrome, which occurs when someone is quite severe with coronavirus and COVID-19. So the first thing I want to mention is there's several studies now coming out where different types of stem cells called mesenchymal stem cells have been used to help repair and improve the function of those with this virus. A report just came out of Israel, in fact, where 6 people who were in critical condition were treated with these stem cells, and every single one of them lived. And these are people who are immunocompromised, and they did not suffer from the end organ failure, such as heart failure or kidney failure, that is occurring all too often. So that's something that we'll have to keep our eyes on. The second area that I'm very impressed with, I've been using now in my practices, are called exosomes. And what are they? Well, they are the fluids that are secreted. They are secreted by these stem cells. And so they're actually fluids that contain something called messenger microRNA, growth factors, and different proteins that actually help repair when there's damaged tissues. So they help regenerate our body. So if we're running into problems with lung failure, or ARDS, or even the kidney and heart failure, I think these stem cells and exosomes are something that may be crucial for us to survive and to help repair and get us back to normal, getting us out of the hospital and keeping us well and healthy. The second area I want to mention as part of the regenerative process includes something I've been using now for a while, which I've been very impressed with, called therapeutic peptides. Peptides are short chains of amino acids, usually less than 50 amino acids linked together. And there's 3 in particular that I'm very impressed with in regard to what we're dealing with now with the virus. And the first is a master regulator of our immune system. It's a modulator. It's called TA1, or it's also known as thymosin alpha 1. And this helps to upregulate many of the pathways that we need for our immune system to function properly. The second is known as thymosin beta 4. This helps to reduce fibrosis. And so with people who are having the lung problems, if they get onto these peptides, especially the thymosin beta 4, right away, it can help reduce the susceptibility to the lungs failing. And the third peptide that I'm impressed with is something called ketone esters, which is actually just a liquid that can be, you drink it. And this helps greatly to reduce what's called reactive oxygen species. And when we hear about these cytokine storms that are occurring in severe cases of COVID-19, part of it's because of these cytokine storms. And if we pair all these different things together, especially these 3 peptides, the ketone esters, the thymosin alpha 1, and the thymosin beta 4, I truly believe that we would see much better results and not run into the cytokine storm that we're seeing, which leads to the ARDS, which is respiratory failure. Once you have that respiratory failure, frequently you're going to have failure of other organs, such as heart and kidney failure, and sometimes it leads to morbidity, greater morbidity and mortality even. So these are just some of the different aspects that are cutting edge right now. We don't have great evidence yet in any clinical trials in regard to the coronavirus, but I want to tell you that clinically, there's been many reports now that these agents can truly be helpful if you combine it with all the other best modalities that are out there. So I want to thank you very much for listening to our series. Once again, if you missed any of them, it's available on our Facebook page as well as Magazine for Wellness YouTube pages. And if you want to contact my office to get more information about any of these treatments and therapies, please contact us by phone at 856-424-8222. Do that again, 856-424-8222. Or just email us at magazinercenter@drmagaziner.com. So thanks so much for listening. Stay well, stay healthy. Remember the basics. Don't forget the basics. Social isolation, stay home. Wear a mask. Wash your hands. Get appropriate sleep. Drink plenty of fluids. And best of luck with everything. So let us know how we can help you. Thanks so much for listening.